Expectant mothers can experience a lot of changes to their body during pregnancy, a lot which can lead to pain and dysfunction. I'm Denice Justus.
And I'm Haley Jarvis, and we're physical therapists at Salina Regional's Outpatient Physical Therapy.
Well, thank you so much for being on the show, ladies. Before we talk about the physical therapy part of it, let's talk about some of the issues that women have when they're pregnant or after they've delivered.
Sure. Women can have low back, hip, pelvis or pelvic floor pain just from weight gain, and the weight shifts to the front, and so they have more pressure in the back. And they can have overstretching of ligaments. The hormone relaxin is present, so that makes everything a little bit more unstable.
Yeah, and the extra weight also can lead to pressure on your bladder and then the other internal organs in your lower abdomen as well, and that can lead to incontinence issues or prolapse.
All right, well, let's take a look at where physical therapy comes in then.
One of the big things is just listening to your body and understanding how to move maybe more appropriately, especially when it comes to body mechanics. Things are changing so rapidly during pregnancy that it's really important that we stay symmetrical, and when we're lifting, bending, doing things like that, we are doing that in the most efficient way possible to stabilize around our pelvis and our core in general.
And then we can also recommend like a stability belt or like a to help support when you are pregnant as you're getting larger, something to support that belly, to take off some stress from the low back. And then we also can do some manual therapy techniques, some soft tissue mobilization. We have some really cool, we have a really cool pregnancy pillows, some pregnancy support pillows that the mom can actually lay down on her stomach, which they kind of really love to be able to lay on their stomach while they're pregnant. It's kind of cool because there's a hole cut out for their stomach and their chest, and so they don't have any pressure laying on their stomach, and that helps them relieve some pain with that too.
There's a lot of ways we can teach them to use pillows that they have at home without having to use a pregnancy pillow as well. Aquatic therapy is a great option to take a lot of the stress and the weight from the baby and your changing body off, so you can still get a great strengthening program out of that, and to work on stabilizing around your pelvis and low back and trunk. Another thing is making sure that those active moms are really safely progressing back into or continuing their exercise program, so we can definitely help with guiding them through that. And just remember that so many of these issues are common, but they're not necessarily normal, so definitely give us a call.
So if someone is pregnant or already delivered and they think physical therapy might be useful, how should they get a hold of you?
Well, they can just call their doctor, and their doctor can refer them. Okay. If they're not Medicare, and they can self-refer themselves. We have direct access in Kansas, and so they can just call and refer themselves.
For more information, you may visit the Outpatient Physical Therapy page of srhc.com and like us on Facebook and follow us on Twitter and Instagram.